Hi, I'm Chris, and today I'll be performing a head-to-toe physical assessment on an adult. The first thing I'm going to do is I'm going to introduce myself to the patient. So I'm Chris, I'm the student RN, and I'll explain the procedure as well. So today I'm performing a head-to-toe physical assessment on you. I'm going to let you know of everything I find, and I'm going to document it all, okay?
Okay.
All right, so at this point I'll go and wash my hands. Hands are washed. And I would also provide privacy for the patient using the curtain. So what is your full name and date of birth?
Lisa Riccio, 12774.
Okay, and I would confirm what she just said with a secondary source of identification, which is her bracelet, and it's correct. Okay, so I've explained the procedure, I've given her the intro, I've provided privacy for the patient, I've washed my hands, and I've confirmed her identity. So next, go ahead and stand up for me, and we're going to get your height, weight. Very good.
Well, no, I can't remember.
So you see what I did there?
Yeah, I just remember.
All right, I got your weight, your height.
Your mitral valve.
And step off. Very good. Okay, so that's height and weight, and then now I'll get your waist circumference. So just face this way for me, arms out to your sides. Very good. All right, you can take a seat. So I would use the patient's height, weight, and waist circumference to determine her body mass index. And then this is also the point of the general survey where I would obtain vital signs. So on a scale from 0 to 10, are you feeling any pain?
No.
And do you have any allergies?
No.
Okay. So the patient has no pain and no allergies, and then at this point I would obtain vital signs as well. This concludes the general survey. Now I'm going to move on to the neurological assessment and the cranial nerve assessment. So neurological, I'm going to assess her level of consciousness. So she's looking at me, her eyes are open, so I determine that she's alert. As far as her orientation, I would ask her a few questions. So do you know where you are right now?
The doctor's office?
And do you know who I am and what I'm doing?
Yes, you're the nurse and you're doing an assessment.
Good, okay. Do you know what today's date is?
October.
Okay, good. So the patient is alert and oriented times 4, person, place, time, and event. When she was speaking to me, I could assess her speech, and from that I could determine that she's not confused, she knows where she is, and her speech is clear as well. So moving on to the cranial nerves, go ahead and shrug your shoulders for me. Very good. Stick out your tongue, wiggle it around. Good, good, good. Okay, frown, smile, wrinkle your forehead, puff out your cheeks. Very good. So I just assessed all the cranial nerves and it's good. So now moving on to the head and neck assessment. For head and neck, the first 3 things I'm going to look for is the color, condition, and the temperature. So I can do all that by just touching the forehead. The temperature is warm, the condition is dry, and the color is within normal limits. It's pink, it's white, there's no cyanosis, no jaundice, nothing abnormal. So now I can move on to inspecting and palpating the scalp after I get gloves. Inspecting the rashes, scars, lesions. Did it stop?
Yeah. Hold on.
Okay, so with the inspecting and the palpating the scalp, I'm looking for any scars, lesions, rashes, dryness, bumps, nits or lice, anything like that. So I'm inspecting the hair and the scalp, just sifting through, and also touching with my fingers and palpating and making sure there's no abnormalities. That's good. Okay. Dispose of the gloves. Okay, so inspecting the neck. As far as this goes, I'm only inspecting the turgor right now. So I'm just going to pinch the skin and see if it tense. And she's well hydrated because the skin is elastic and it rebounds quite nicely. So that concludes the head and neck. Now I'm going to move on to the ears, eyes, nose, and mouth. So with the eyes, just by looking at them, I'm making sure that they're symmetrical and that they line up. I'm looking at the pupil size, which with just looking at them, it looks like it's within normal limits. And then I'm also going to check to see if they are equal, if they're round, and if they react to light. So just go ahead and look at my nose for me. In this first pass, I'm looking at the eye that I'm shining the light into. And the second pass, I'm looking at the opposite eye to react. And same thing on this side. Good. The pupils are equal, they're round, they react to light, and their size is within normal limits. So next I'm going to test the extraocular movement. So go ahead and just look at the pen for me. I'm testing all 6 fields of vision. I'm making sure the eyes, both eyes are following the pen. Now I'm testing for accommodation. Go ahead and keep looking at the pen for me. And both eyes should follow the pen going toward and away, and they do. With the eyes, I'm also inspecting the color of the sclera, which is white. I'm looking at the iris, which is a green. And I'm also looking at the conjunctiva, which is underneath, which is pink and moist. So it's all within normal limits. That concludes the eyes. Moving on to the nose. I'm looking at the nose, looking at the position of it. It's aligned well. It doesn't appear to be broken. I'm assessing for drainage, which there is none. And then I'm also testing for patency. So go ahead and block one of your nostrils, blow out. Again on the other side. Good. So the nose, both nostrils are patent. With the ears, I'm making sure that they're symmetrical on both sides and they're aligned well, which they're both. They're both present and they're both aligned. I'm looking in each one for any drainage. And there's no drainage. At this point, I would get an otoscope and I would pull up on the pinna and back, and I would look at the tympanic membrane, which should be slightly pink and translucent. And then at this point, I'm also palpating the pinna. Do you feel any pain? How about this one?
No.
And I'm also inspecting it for anything out of the ordinary, any bumps, bruises, contusions, scars, lesions, anything like that. So that concludes the ears. Moving on to the mouth. Using the tongue depressor, go ahead and open up your mouth. So with the mouth, I'm looking at the buccal mucosa on the bottom. And it's pink and moist. I'm looking at the hard and the soft palate. Good. And I'm looking at all the teeth. They're all present, and there's no swelling, no rashes, nothing like that. Go ahead and stick out your tongue. Say ah.
Ah.
The uvula vibrates when she says ah, and I'm looking at the tongue as well. And all of it looks good. I'm also looking at the mucous membrane in there, and it's pink as moist. So that checks out as well. So, ears, eyes, nose, mouth. All right, so moving on to the neck. Assessing the neck, the first thing I'm doing is I'm looking to see if it's symmetrical, if it's equal on both sides, which it is. Next, I'm going to palpate for the thyroid to see if it's swollen, which it isn't. And then here I'm also assessing the trachea's position, whether it's delineated or not, and it's midline, so it's good. Very good. So while I'm here, I'm also checking all the lymph nodes. The first set are the preauricular, which are in front of the ear. I'm just going to palpate for any swelling. There's no swelling. Postauricular behind the ear, no swelling. Submandibular or submaxillary, no swelling. And then supraclavicular, there's no swelling there. So that concludes the assessment of the neck. Moving on to respiratory. First thing I want to do is I just want to getting a sense of how she's breathing. So from this distance away, she doesn't look like she's labored. The quality of breathing, it looks equal on both sides. It doesn't look like she's struggling to breathe or anything like that. She's got good skin color. So first I would inspect, which I already did, inspect the anterior thorax and then palpate the anterior thorax. So with palpating, looking for anything out of the normal, seeing if one side rises and the other one doesn't, which it's good and equal. No pain? No. Okay. Good. So after I inspected and palpated the anterior thorax, I'm going to listen, I'm going to auscultate for lung sounds. Alright. This is using the diaphragm, listening for lung sounds. The first place I'm looking is the second intercostal space. That's 1, and that's 2. Deep breath for me. Good. Deep breath. Good. breath sounds are nice and clear, and they're equal on both sides. No crackles. No, sit up nice and straight for me. One more time, deep breath. Good. Again. And last one. Okay, so nothing out of the ordinary. Same thing with the posterior thorax. I'm inspecting. I'm looking at it. Is it good quality respirations? Is it equal on both sides? And then the same thing with palpating. When I palpate, I'm just feeling for her breathing. I'm feeling for any abnormalities. And it's good quality. So now I can auscultate. Deep breath. Good. Again. 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 Good. Again. Last two. Good. Okay. So I'm just going to percuss the posterior. I'm going to percuss the anterior as well. And with this, I'm just looking for resonance. It should sound hollow. Anything other than hollow would suggest some sort of fluid buildup. Okay. And I'm just going to percuss the anterior as well. Okay, good. So next I'm going to check for the tactile fremetus. So with that, I'm just going to place my hands together at the top here, assessing the front or the two top lobes of the lungs. I'm just going to have her say 99.
99.
And once again, I'm assessing for resonance and that vibration coming through. Go ahead again.
99.
Good vibration. Again.
99.
Good. So now I'm going to test for thoracic expansion or excursion. I'm going to place my hands between T9 and T10. My thumb's about an inch apart. I'm going to have her take a really deep breath. My thumb should separate as she takes a deep breath in. Go ahead. Good thoracic expansion. So moving on to cardio, I'm going to make sure that she's in the proper position for it. So just go ahead and sit back. And I'm making sure that she's at a 45-degree angle. So the first thing with cardiac is I'm going to assess for any jugular vein distension. So right now, I can't see any jugular vein distension. There's no bulging or anything like that. And I'm also going to auscultate the carotid arteries on both sides to ensure there's no bruit. Just turn your head that way for me and hold your breath.
I think someone just said it. So that's why I
Okay, you can breathe now. All right, turn your head toward me. Hold your breath.
Yeah.
Good. Okay, you can breathe again. Okay, so there's no bruit, and I already assessed for jugular vein distension. There's no jugular vein distension. So moving on to auscultating the cardiac sounds. The first one I'm going to assess, and the first time I go through, I'm going to use the diaphragm. The second time I go through, I'll use the bell. The first one I'm going to assess is in the second intercostal space on the right-hand side of the patient, and it's on the sternal border, and that is the aortic. And I'm listening for murmurs, and I'm listening for the quality of the pulse, the rate, the rhythm, anything that stands out, any extra noises in there, and if there's a good distance between S1 and S2. And then moving over to the second one, second intercostal space on the left-hand side of the patient, that's the pulmonic. Good. Between the second and the third, that's the second pulmonic or the Erb's point. Good. Third and fourth is tricuspid. Good. And then the fifth is the mitral, and that's also the where we get our apical pulse rate and rhythm. While I'm here, I'm going to get the apical pulse for 30 seconds, unless I detect an abnormality, and then I'd count for a full minute. Okay, good rate, rhythm, and quality. So now I'm going to go through one more time using the bell of the stethoscope to listen to heart sounds, to listen to low-pitched heart sounds. So once again, the second intercostal space, listening to the aortic. Good. On the opposite side, second intercostal space, pulmonic. Between second and third, the second pulmonic or Erb's point. Third and fourth, tricuspid. And then the mitral or the apical. Good. Okay. So now I'm going to check all the pulses bilaterally. So the first one's being the temporal, making sure they're both present and they're equal. And they are. Carotid. Good. Good. Brachial. Good. Good. Radial. Good. And while I'm checking these pulses, I'm looking at the fingers, and I'm looking for any clubbing, which I don't see, and I'm checking for capillary refill, which should be less than 3 seconds. It's good on that side. No clubbing on this side either. Cap refill is normal, under 3 seconds. I could check the femoral pulses. I could check the popliteal also, but instead I'm going to check the dorsal pedis and the posterior tibial. Posterior tibial is behind the foot, on the inside of the ankle. It's present. Present. Dorsal pedis is just above the big toe on the top. Present. And it's present. While I'm down here also, I'm checking for any edema, which I don't see. I can press on the skin and it doesn't stay in. So there's no edema also. So that concludes the cardiovascular assessment. So moving on to gastrointestinal, I'm going to position the patient properly. However you do that.
The thing, there's a little bar back here behind me.
Did I pull it?
Yeah. Pull it up.
Okay. All right, so the patient's been properly positioned. Go ahead and raise your knees up for me. This is going to help relax the abdominal muscles. So the first thing I'm going to do is I'm going to inspect the shape of the abdomen. Is it really saying there's any issues here? There's no scars, lesions, bumps, bruises, anything weird. So I inspected the shape. Now I'm going to auscultate to all 4 regions. I'm listening for any gurgles or crackles or clicking. And I do hear activity. I do hear activity. And I do hear activity in all 4 quadrants. Next, I'm going to lightly percuss, and then I'll go into palpation. So percussing, I'm doing all 4 quadrants. Good. Okay, next I'm going to lightly palpate all 4 quadrants. If you feel any pain, let me know, okay?
Okay.
Any pain?
No.
Basically, I'm feeling for any organs that are larger than they should be, any masses, any hard spots, anything like that. So now deep palpation. And I'm removing my hands quickly to see if there's any rebound tenderness. Do you feel any pain when I remove my hands?
No.
Too much?
Too much.
And no rebound tenderness. Removing my hands quickly to see if there's any rebound tenderness, which there isn't.
Nope.
All right, good. Okay, so I would also ask the patient, have you had any nausea, vomiting, diarrhea, or constipation lately?
No.
No. Okay. So that concludes the abdominal assessment, and now we'll move into muscular and coordination. Okay, so go ahead and sit up for me.
Okay.
And put your shoes on. Okay, so go ahead and stand up and come right here for me. Okay, so first thing we're going to do is we're going to do some walking exercises. So the first one, I want you to just walk normally, walk to the chair.
Okay.
And then with this, I'm assessing her gait and see if she's putting more weight on one side than the other, or if there's some sort of imbalance. All right, this next one, I want you to walk heel to toe, like you're walking on a balance beam. This one, same thing. Any abnormal gait, if she's straying to one side, if she's unbalanced. Okay, good. Stop. Turn around. Now walk on your heels for me. Very good. Turn around. Walk on your toes. And very good. Okay, stand right here. And just bend over at the waist. So with this, I'm inspecting, is there any curvature of the spine? Is there any sort of lordosis, kyphosis, scoliosis? And I can see that there isn't. The spine appears to be midline. And then here I'm also assessing the pelvis, seeing if it's lateral. Go ahead and stand up straight. Good. And the pelvis is equal on both sides. One side isn't higher than the other, and it's intact. Okay, so next, go ahead and take a seat for me. All right, squeeze my fingers. Very good. Okay, push against my hands. Nice. Pull against my hands. Very good. Okay, range of motion on your wrist. Rotate elbows. Very good. Shoulders. Awesome. Okay. All right, next, go ahead and lift up this leg for me. And this one. All right, now do it. Go ahead. Good. Good. Push out. Pull back. Same thing with the feet. Push up. Push down. Good. Okay, stand up one more time. All right, have your feet placed together, arms at your sides, close your eyes. This is the Romberg's test, so I'm assessing her balance. See if she falls off to one side while she's doing this. We'll wait for about 20 seconds. Okay, good. All right, go ahead and have a seat. And just remove both your shoes for me. So next I'm doing the Babinski reflex. So I'm going to draw the end of this handle here across the bottom of her foot. And the toes, the toes will curl, which is the normal response, so that's good. And that's a good response too. What we don't want to see is flaring where the toes go out. There you go, you can put your shoes back on. All right, very good. That concludes my assessment.